Hello everyone, my name is Dr. Prashant. I'm the Chief Medical Director here at DocOnline. So today, in this session, we will talk about asthma. We will specifically cover the prevalence of asthma here in India. We will talk about what actually happens inside your lungs, what goes on inside your lungs when you get an asthmatic attack. We will also talk about the trigger factors which lead to an exacerbation of asthma, and we will also talk about medications that are used to treat an asthmatic attack. So, asthma is a chronic respiratory disorder in which the airways inside the lungs they are inflamed and narrowed, which leads to breathlessness, it leads to wheezing, it leads to chest tightness, and it leads to cough. Now, what's important here to understand is that these symptoms typically occur mostly at night or early in the morning in most patients. Now, let's talk about why does the asthma happen in the first place. So, in order to understand this, we need to know that our lungs are lined up with millions of small airways. These are called bronchi or bronchioles in medical terminology. These airways are actually lined up with smooth muscle layer. In a patient who is asthmatic, these airways become more sensitive to certain substances. So, if a person is exposed to such a substance, if he inhales such a substance, the airways get inflamed and narrowed, leading to the symptoms of asthma. Now, one of the most crucial aspects of treatment of asthma is to understand what exactly is triggering an asthmatic attack. Right? So, asthma triggers are substances or conditions which actually precipitate an asthmatic attack. So, these range from your usual allergens like pollens, like animal fur, like chemicals originating from a polluting factory, like pollution in the environment, like some medicines which can also precipitate an asthmatic attack, like beta blockers, and sometimes even physical activity like vigorous exercise can also precipitate an asthmatic attack. Mental stress is also a known factor which sometimes precipitates an asthmatic attack. What is also important for the patients to understand is that there exactly is no cure for asthma. So, as I mentioned before, one of the crucial part of treatment is to identify what are the triggers which are causing an episode of asthma and to avoid them. That will take care of 50 to 60% of your problems. For the remaining 40%, there are some medicines that are often prescribed by the doctors. Now, these medicines are either inhaled bronchodilators. Now, inhaled bronchodilators are medicines which are usually given by an inhaler and they directly go inside the lung and act on the airways and helps them to dilate, right? And thereby helping you to breathe easier. Another important medicine is steroid, which helps in reducing inflammation. Now, steroids usually are often combined with inhaled bronchodilators and given as an inhalational therapy. Sometimes, during an acute exacerbation, patient might also require oral steroids. So, whenever a doctor is treating a patient with asthma, there are few goals that he keeps in mind. The first one is to make sure that the symptoms are controlled optimally. The second one is to make sure that a number of acute exacerbations of asthma that are happening in a year are brought down to a minimum. The third one is to minimize the side effect of the medications that are being given in the first place. The whole idea is to make sure that your asthma is so well controlled that you can go to your work, you can go to your play, you can play your sports, you can do your exercise without having the limitations of an asthmatic attack. Together, let's spread the awareness about asthma. Thank you.